So we're going down sideways. Okay. All right, we're here today with Ileana, and Ileana is about to start her treatment with Dr. Davis. So, Ileana, tell me, what's been going on with your knees?
I can't walk
And how long has it been like that?
since a long time.
Can you give me a year?
No, much more.
2 years.
From an accident when I was 12 that
Okay.
they had to reconnect my leg because it broke completely. And then 2 car accidents. They did knee surgery on my meniscus. And now I have bone to bone.
And how long has it been like that it's been bone to bone?
06, from 06 now. to
Okay. Okay.
now. So you're talking about 12 years.
Okay. All right. So what is this holding you back from doing? What is it that you like to do that you can't?
Dance to God.
You like to dance to God. Yes. Amen. Okay. So we got to get you back and get you active and get you dancing again. So what is your discomfort level today in that knee? What is your pain level?
It's about a 7.
About a 7?
7, 8, yeah.
Okay. Well, we got to get that lower. So what I'm going to have you do, Ileana, I'm going to have you stand up for me. Okay. So Ileana, did you have any discomfort when you were doing that? Where does it hurt?
Here.
Okay, like above the knee there?
Mainly here.
Mainly there.
And then it goes down and it shoots down on the side of it.
Okay. All right. So standing there, I'm going to have you do a squat for me. So arms out in front and just try to go as low as you can. That's good.
That's it.
Okay. Now, where did you feel the discomfort when you did that?
In the
Same
front.
spot?
And also, I
You're-
wobble.
Right.
My balance.
Yeah, right. Because your balance isn't very good and you've been having problems falling down, right?
Yes.
Okay. We got to get that fixed too. All right. I'm going to have you go up and down the stairs for me. I'm going to have you hold on to the railing.
Can't do that.
You can do it. I know you can. One step at a time.
I really can't.
So we're going down sideways. Okay.
Oh, yeah.
Okay. We just want to see how you're doing it.
Holding up.
Yeah, absolutely. Yes.
Just
And you're using your good leg when you're going down?
yeah.
Okay.
And my good arms.
And then you follow with your bad knee and your bad arm, right? Because everything with you is on the left side.
Yeah, mainly, yeah.
Mainly on the left side. Okay. All right. Let's go back up the stairs again. How do you go up the stairs?
I don't usually do stairs. Put my weight on my arms. Don't make me do this again, please.
Well, we'll have to talk about that with Dr. Davis. Okay. So out of all of those exercises we just did, which one caused you the most pain?
Going up the stairs.
Up the stairs is worse than coming down the stairs. And is the pain in still the same spot that as before?
Yeah, it's the same. It doesn't go away.
Okay. All right. Then let's get you started. All right. We're back with Ileana. Ileana's finished her first treatment with Dr. Davis, and there she is. All right. I'm going to have you stand up for me, Ileana. All right. Well, that seemed easier. Okay.
The people do all kind of.
Yep, they sure do. All right, let's see if we can do that squat again.
What?
Feet shoulder length apart, arms out in front. How low can you go? Whoa. That was a lot lower. Holy smokes. All right, let's try the stairs. I know this is not your favorite, but we're going to work on this. We're going to have you going up and down those stairs tandem stepping. So that's my goal.
Yeah, but I'm not gonna do that today.
Ileana, that's much better.
But this is better.
That is much better. You were faster. You looked like you were a little bit more at ease.
Yeah.
Okay.
I'm froze everywhere.
I know it's a little chilly out here, but Florida weather. Cha-cha-cha. You want to get back dancing, right? We're already got one step going there. Look at that. Only one hand this time. Look at you.
I cannot put my weight on it.
You're doing awesome. You're doing awesome. Oh, Ileana, you've done so much better. What changes have you noticed? What is different than when you first walked in here today?
I have less pain now.
You were a 7.
Yeah.
What
But
are you
I don't
now?
want it to come back.
And you
because
don't want it to come back.
I get a little better and then
So what is your discomfort level now? You were a 7.
I would say it's like a 3.
A 3? Perfect. Perfect. Now your homework is to go home and walk your dog. What's your dog's name?
Pelusa.
Palusa? You're going to have to take a picture so I can see what Palusa looks like.
She's a Cocker Spaniel.
Oh, awesome.
And I have to go buy some tutu because I want to make her a skirt
Awesome.
for Christmas.
And we're going to see you back here tomorrow afternoon, okay? Are you happy with your results for today?
So far, so good.
Yes. All right.